We're back, and joining me is renowned local orthopedic surgeon, Dr. Kenneth Cervone,
Thank you.
one of the principals here at the beautiful Shelby Macomb Medical Mall. And Dr. Cervone, we just interviewed the supervisor of Shelby Township, Antonio Morelli, the brains behind this, but he couldn't do it without you and some of the other docs here. What was your motivation to, obviously a successful practice, relatively local? What was your motivation after talking to Dr. Morelli and some of his ideas to actually making the move? It's a big move. I mean, you guys have a large practice, a lot of docs. To move a whole office, this isn't just moving a house. I mean, it's like moving 10 houses. What was your motivation to actually make this move out at the 23 and Chainer?
Well, when Dr. Morelli called us and presented the concept to us, it really made sense. Here we had a top-notch doctor who was very, very well known in the area and has very high regard for his patients, as does his whole group. And he's asking us to come in on something that we believe, and in fact, some of our patients have already gone to him and speak very highly of their group. Our own physicians in my group have him as their physician, and our families go to him as well. So we trust him, and basically he wanted us to come in and become the orthopedic doctor for their facility. So that combined with where he wanted to put it, in Shelby Township, a premier location, 23 and Chainer, the infrastructure fits it well. It's easy to get to. It's a growing community, and it's also something that we felt we wanted to do anyways, move out this way. So it was a win-win situation, we felt. As far as the concept of all doctors under one roof in different disciplines, we felt that doctors can best care for patients if we have what we call continuity of care, which means that we're all on the same page and we make it easy for the patients to get full service health care. And that's what the facility seemed to offer us.
The gaps aren't good.
Gaps are not good.
Yeah.
Certainly, I think that the gaps are cut down here. For example, if you come to our urgent care, it is an urgent care that's not a freestanding facility. It's associated with a number of doctors, up to 20 different disciplines. So if you come in, for example, orthopedically, a broken ankle or some other injury, you can be seen in the emergent care, urgent care, stabilized, and then they can call us and they can, right down the hall, in fact, in this case, the same floor. Orthopedic patients have to have same floor, on the ground floor. Yeah, you don't want stairs or elevators.
Versus going to the car, getting in the car, going somewhere, maybe up 2 stairs.
You don't even have to go upstairs here. We're just on the same floor. Send it down. We're going to have office slots available for emergency care patients. So
out of the urgent care center.
Right out of the urgent care center.
Out of Henry Ford Hospital.
Henry Ford Hospital, absolutely. And they're going to call us, say, hey, we have a patient for you. They're going to come down. If you need a referral, you can stop, and if your doctor's here, you can get a referral on the way to see us down the hall. Then you're going to come see us. For example, if you need surgery, it's something that needs surgery. Traditionally, the gaps would occur where you need surgery, you have to get medical clearance. And then you have to perhaps sometimes go and get an MRI or a CAT scan or an ultrasound or bone scan, whatever it might be. You have to get out, go in the car, go home, make an appointment, schedule 2 or 3 appointments, and then eventually get these done. It might take 2 or 3 weeks. Well, now you can theoretically get it done within the same day, your MRI, see your orthopedic surgeon, get scheduled for surgery, possibly even get medical clearance for surgery. And so you're home from surgery, recuperating, possibly within a few days, where it might take a week or 2 to get everything taken care of when you have to go to a different site. St. Clair Shores for my primary care doctor. My cardiologist is in Clinton Township. I have another doctor I have to see, all just to get the surgery cleared so you can be taken care of.
So you're basically at home healing before the paperwork in the traditional environments is even completed yet. The patient's already at home.
Absolutely. That is potentially the scenario.
And I'm sure you had some influence in Henry Ford coming here since you're the chairman of the Department of Orthopedics at Henry Ford Macomb, correct?
I am, and we were very excited. Henry Ford facility was very happy to be a part of the institution here. They've always provided very good care in their urgent care centers that are out in different parts of the community. But now they have direct access to us in the same building, and hopefully we're going to streamline the health care, which is going to be beneficial for the patients. We have patients that are elderly. They need to rely on their daughters or sons to take off work. And if they have to see 2 or 3 doctors to take off work and see 2 or 3 doctors, that's very expensive. And now in this, especially with the economy now, they don't want to do that. Some of our elderly patients that have to drive themselves They don't want to get in and out of a car 3 or 4 times. I have patients that have trouble just getting from their car to my office, the door. So now this makes it less stressful for them. It's convenient and it's efficient, and it's really good healthcare delivery.
What's nice too is since this is from a ground up versus your needs and what you all have over the years in your practice, you took over a building, let's say, for the PT and all that. You actually designed it with patient ease and care in mind from the ground up. I mean, you guys, I'm sure this is going to be laid out different than your other facilities.
Absolutely. The nice thing that Dr. Moriali had, it was a really nice design team that worked very, very closely with us. We were able to tailor make what we thought would be the optimal facility for orthopedics and physical therapy. We have our own physical therapy, which is located directly across the hall from our offices. And we were able to put in a state-of-the-art pool along with state-of-the-art facilities and design it so that it's user-friendly to our patients with all the doorways and the walkways. And basically, from when you step in the door to when you leave, everything's designed around an orthopedically injured patient.
Kind of a play on words. You said across the hall, but in the traditional environment, you don't mean across Hall Road, which some patients may have to go.
Yeah,
to
you
the
don't,
second
and you
step.
don't want to cross Hall Road if you can help it at any
certain
time.
times of the day.
Yes,
Yes.
but yeah, absolutely, right across the hall. And the nice thing about it is that if there's a problem with a patient in physical therapy, they want to talk to their doctor. The therapist doesn't have to call on the phone. They just come and get us. We'll go across the hall, say hello, see what's wrong. If there's a problem with a wound, if there's a problem with the patient hearing a funny sound in their shoulder or whatnot, it really is helpful for the patients, and I think we're really looking forward to that.